Let's imagine better health with CHI Health. We first met our next guest in October. His approach to caring for patients really stood out.
Sometimes going the unconventional route to keep them healthy, including a rap video about how to prevent falls.
He's a rapper and a doctor. It's a pleasure to welcome back CHI Health orthopedic surgeon Daniel Firestone. Good to see you, Doctor.
Nice to have you.
Thanks for having me back.
Rap videos, right? Yeah, well, there's one rap video in particular. You've kind of become a familiar face on those YouTube clips. How did this come about?
Well, last time I was on, I promised a rap video, and I thought the timing of the year was right to maybe make a don't slip on the ice or safety video, and so I threw down some lyrics, and
yeah, the track, the funky beat came with it, right?
I made the beat.
You made the beat, yeah.
Everybody loved it. I mean, everybody was talking about it. Did you hear about this doctor in this video? People really ate it up. In case our viewers haven't seen it, I'm going to play part of it here.
Yeah, please do.
So they can appreciate your skills.
Now come on everybody, and I'll take you to the hook. Don't slip on the ice, you're gonna break your hip. Don't slip on the ice, you're gonna bust your lip. Don't slip on the ice, you're gonna break your wrist. And if you break your wrist, you might need it fixed. Bend your knees and take shorter steps.
And then you instruct us to walk like a penguin,
Right.
It's
Yeah.
about prevention for you. Stay healthy.
It is. You wrote those lyrics too, right?
I did.
Yeah, and you broke it down. I like your voice, the voice tone that you took in there.
I don't know if
so
that's just
funny.
my natural rapping voice or what, but it was pretty funny with the exposure that this video's got, and I even received a phone call from a marketing agency in New York, and they represent a company that makes a ice or a salt alternative for not slipping on the ice called Traction Magic.
Right.
And so this guy calls me up and he's like, hey, can we send you a sample and test this out? And
Right.
Unfortunately, most of the ice around here is melted by now, so we just got it. But I was like, hey, it expanded beyond Omaha, and someone in New York City saw the video, and
They loved it.
yeah.
What type of injuries did you see? Because you deal with these, in all seriousness, you
Yeah.
deal with a lot of injuries and falls. What type of injuries did you see this winter from ice?
Typically the thing I kind of allude to in the lyrics, the most common thing is breaking your wrist, or what we would call in orthopedics a distal radius fracture. So
when you brace yourself, is that what, when people are falling, they brace themselves with their hands?
that's exactly right. Instinctively, you're going to reach out with your arm like this, and then the force from the ground and your weight coming on it is applied through the hand, and most commonly what happens is you'll break the end of your forearm bone, and I've got some models, the end of your forearm called the radius, and so when people talk about a wrist fracture, that's typically what we're referring to as a broken end of your forearm bone called the radius.
So this, that plate, we're not born with that.
No, hopefully not.
But that's how you repair the break, right?
Exactly.
So when you're fixing a fracture, I mean, I imagine every break is unique. What am I doing?
I was just going to see if you wanted to
Let me
see it.
this.
So what is your approach when a patient comes in, they've got a fracture, you're sizing it up, how do you decide about the best way to fix it?
Sure. So essentially, if somebody comes in and you're suspicious for it, if they come in with wrist pain and they said I had a fall, and if they had not already been to the emergency room or urgent care and had had x-rays, we would absolutely take x-rays, because that's going to tell us kind of the severity of the break or the fracture pattern. And in my mind, I can then counsel the patient and say this is kind of on a scale of 1 to 10. And typically, I mean, there still are some that absolutely can be treated in a cast. I mean, you can sometimes see little cracks and things that really aren't out of place, but the whole goal is if you can get that bone back into the unbroken alignment or the position it was in before the injury and make sure you can keep it there, then you can count on the patient doing reasonably well.
And so these plates, right, you can use a plate to sort of create that alignment again.
Correct.
But it's not a one plate fixes all.
That
type of
exactly
solution,
right.
is it?
So the way I explain, one, if you've got to break the news to somebody that they may need a surgery, I explain to them that the plate isn't there to necessarily correct the alignment. You correct the alignment during the surgery, but it holds it in place while it heals. It doesn't allow it to heal any quicker than it normally would, but what it does is it gives you much more confidence that it's going to stay in place. And that's your goal, is, yeah, you put it there either by putting it back in place in the emergency room or surgically, but you want to keep it there. You want to have the confidence that it's going to stay. So the model that you guys are looking at right now, that is called a volar plate or a volar locking plate. Volar means the palm side of your wrist.
And it's kind of a T plate.
Yeah,
it's similar shape to a
I
T
even
or-
say it looks like a spatula.
Sure,
But the idea is there are different sizes of these, but typically they're made to fit that little contour under the
Here.
underside
I'm
of
gonna
the wrist.
What is this?
And so
this
I've
is a
got
different one.
and I've got some others because again, the biggest goal is to restore the anatomy to where it belongs. And there is a more current concept called fragment specific plating, and these other options I have here are for when the single plate from the palm side really can't hold those pieces with confidence.
You're talking about this plate right here.
Exactly. There's a
You
plate
add a
there, and
plate
there's a plate on the back.
on the side.
And the other model I have, there's a plate that comes along the thumb side. Because really there are a lot of pieces that we can predict may happen as the severity of the injury increases. And you can't count on the first plate I showed you to hold all those in place, so you need to address them all appropriately. And these small plates can give you more confidence that you're holding those pieces where they belong.
And this is where the experience and the judgment of the doctor comes into play
Yes.
here.
You travel the country and you teach other surgeons about new techniques. I think that speaks volumes
Sure.
about what we have in you, that you're in Omaha if you're training others around the country.
Exactly. And so with this, I guess, philosophy or technique of treating these injuries, not a lot of people are necessarily, one, comfortable with all the different ways you have to approach the anatomy surgically, but also to do these small different plates. And so there are various courses and seminars where physicians, especially hand physicians or wrist physicians or surgeons, can come to learn how to do these techniques. And it's an opportunity to get their hands on the technology when they're not practicing necessarily on a patient for the first time. We have models like what you're holding, or what we have sawbones, which are things that you can simulate a fracture, then they can learn how to put the pieces on so they're not necessarily doing it for the first time on somebody.
This is your specialty. Dr. Firestone is the wrist guy in Omaha. And I've said it about you before. I hope I don't need you, but I'm glad you're here because I love your approach to patients and the results as you're repairing those wrists. Just tremendous talent that you have.
Well,
Thank
his
you.
rapping talent as well.
And-
And is there anything new coming out? We have anything new working on the pipeline?
You know, I'm hoping that when the campaign season starts, you may see a YouTube video of me campaigning to be Omaha's hand surgeon.
We're going to show
We'll
it.
vote.
Yeah.
We'll vote for you.
Yeah, and I don't know if there's going to be a ballot for it, but I mean, at least you'll see that I'm campaigning to be Omaha's hand surgeon.
We'll write you in. Dr.
Thanks,
Firestone.
Doctor.
Thank you.
CHIHealth.com. Comedian